Hello, how are you? Many people tell me that they wake up with knee pain, back pain, feel their shoulder or knee popping, have difficulty combing their hair, or even opening their hands. And sometimes this happens right in the morning when they wake up or throughout the day. Some people say to me, Patricia, there's no way around it. It has to do with my age. I'm already over 50, 60, 70, and it's going to get worse. Joints just get stiffer as we age. Of course, this can happen to some people, but we shouldn't view it as something we have no control over or as inevitable. There are indeed things we can do to prevent cartilage from getting worse, and especially to improve cartilage that is more inflamed and stiff. Especially because these cartilage and joint problems are often related to chronic low-grade inflammation in our body. In this video, I have selected the 5 supplements with the most scientific evidence, which prove that they really work. These are natural supplements and many people need this information, so stay until the end, you won't want to miss it. Before we start, I want to ask you how old you are. Do you feel any joint pain? Which area of your body bothers you the most? Write it for me down here in the comments. The first ingredient on our list, the first supplement on our list, there's no way to start this video without starting by talking about turmeric. Turmeric contains curcumin, its main therapeutic active ingredient, which represents approximately 3% of the amount of ingredients in turmeric. In other words, when we take turmeric root in powder form, which you use to season rice, to season chicken, 3% of the turmeric is pure curcumin. So when we think about getting specific results for inflammation, it's no use thinking about using a little bit of turmeric in your diet once a day every 2 weeks, Either you start using it on a daily basis in every opportunity you have in many dishes, right, to add throughout the day, or you go for a turmeric supplement, which is where we can usually extract more of this very interesting bioactive compound. Curcumin has a very interesting effect, a very interesting mechanism of action, because it turns off pain at the root, because it turns off the nuclear factor kappa B. We have to think of it as if it were like a master circuit breaker inside the cells, which when activated initiates a very exacerbated inflammatory process. So when we block this circuit breaker, curcumin drastically reduces the production of COX-2, which is really what generates physical pain in our body, and of inflammatory cytokines such as tumor necrosis factor alpha, interleukin-6, which act as if they were little soldiers, corroding the cartilage matrix and worsening the sensation of inflammation and pain in our body. When we compare turmeric, curcumin with medicines, such as, for example, ibuprofen or diclofenac, which are traditional pharmacy anti-inflammatories, there is an added benefit because these pharmacy anti-inflammatories, they indiscriminately block COX-1 and COX-2. The problem is that COX-1 acts to protect the stomach and kidneys, and when we block it, it can cause gastritis, ulcers, kidney overload, bleeding in many people. So much so that when you look at the package insert for these medicines, these anti-inflammatories, it talks exactly about this, about inflammation, stomach pain, to be very careful to always take it with a glass of milk with a full stomach because it can have this side effect. But curcumin, it already acts as a natural selective inhibitor. It focuses specifically on COX-2, which is related to inflammation. So it relieves pain without harming the stomach and digestive tract. So it is much more interesting. Obviously, I'm not trying to compare in terms of potency. I'm trying to compare in terms of the pathways that are being acted upon. Turmeric won't replace an anti-inflammatory, especially if you've already been prescribed one by a doctor for an acute case of pain. But in the case of low-grade chronic inflammation, where we think about maintaining an anti-inflammatory environment in the short, medium, and long term, turmeric has very interesting results scientifically speaking. Curcumin has an issue regarding its bioavailability, which is usually not that good because it doesn't dissolve well in water, It's actually fat soluble, and the liver can destroy it before it reaches the bloodstream. So to solve this, the ideal approach is to combine curcumin with piperine, which is the component present in black pepper, at the same time in the same meal. So this temporarily blocks that liver barrier and increases the absorption of curcumin by up to 2,000%. So it's a very interesting point. If you're going to buy curcumin or turmeric supplements, it's ideal that they also contain black pepper. And there are some modern options which are phytosomal formulas where the curcumin comes wrapped in a layer of healthy fat which enters the bloodstream more easily. So that could be an option for you. Regarding the dosage to be used, the most studied and established dose is 500 milligrams to 1 gram of standardized curcumin, of standardized curcumin extracts per day. So we usually divide it into 2 doses, one in the morning and one at night, always with a meal that contains healthy fat, because that's what I told you, Its absorption is facilitated when we have healthy fat because it is fat soluble. So you can consume it with olive oil, with eggs, with chia, with flaxseed. So since it stimulates gallbladder contraction, I have to give a certain warning here, a certain precaution for you to take. It is contraindicated if you are a person who has gallstones. So it also has the ability to slightly thin the blood. So if you use anticoagulant medication, if you are going to have any surgery, even oral surgery like a root canal, dental work, or gum treatment, you have to stop taking it 15 days before or avoid it, right? If you already use heavy anticoagulants like warfarin, for example. The second supplement on our list is type 2 collagen. So when we think about joints, articulation, joint pain, we often think of collagen, right? But in this case, it can't be regular collagen, which is type 1 and type 3, that we normally use for more dermatological purposes for skin, nails, and hair. The cartilage in our joints is basically made of type 2 collagen, and when a joint suffers wear and tear, small pieces of this collagen start to come loose, breaking off, so to speak. Our immune system doesn't really recognize these loose fragments, thinks they are something invasive, something it urgently needs to fight, and starts attacking the joint itself, often creating in some people a localized autoimmune disease that can further destroy this joint even more. So this undenatured type 2 collagen, which is usually known by the acronym UC2, doesn't work exactly like a brick to build cartilage. It works more like an intelligent mechanism called oral immune tolerance. So this capsule passes intact through the stomach and reaches the intestine. And look how interesting this is. It interacts with our Peyer's patches, which are, in a way, the defense headquarters of our intestine. So when we expose our intestine to microdoses of this intact collagen, the body starts to learn that this type of protein is a friend, stops attacking it, and sends some peacekeeping cells, let's say, to that joint that was diseased and inflamed to order those defense soldiers to stop this attack. So this reduces the destruction of the native collagen produced by the body, decreases chronic pain, and develops more mobility. So the mechanism of action is really ultra interesting and scientifically proven. The scientific dose is low, just 40 milligrams per day, and the ideal is for it to be taken on an empty stomach at least 30 minutes before breakfast to ensure that this protein reaches the intestine intact without undergoing the digestion that other foods would go through. So it's a great proof. This capsule, it's a great scientific proof, right? It has already had great scientific proof, especially for those who suffer from osteoarthritis, joint diseases like autoimmune ones. So it's an excellent option. If you're enjoying the video, take a moment to leave a like. It's very important to me here on the channel, and if you're new, welcome. Subscribe to the channel and turn on the notification bell. I have new videos every day and you won't want to miss them. The third supplement on our list is one of my absolute favorites, which is omega-3. Omega-3 is a type of healthy fat, naturally anti-inflammatory, and it can act in a very interesting way because it alters the structure of cell membranes. Every cell in our body is delimited by a cell membrane, right? We remember that from school. Every cell has a membrane, a phospholipid bilayer, which means there is fat in every single one of our cell membranes. In an inflamed body, the membranes are full of omega-6 acid, omega-6 fatty acid, which is an inflammatory acid, right? An inflammatory fat that comes, from bad fats that we consume in our daily lives. This type of unhealthy fat produces molecules that perpetuate pain and swelling in the joints. And when we consume omega-3, which is a high-quality anti-inflammatory fat, we replace this bad fatty acid with EPA and DHA, which change the body's chemical profile to an anti-inflammatory path. It's as if we have two paths we can take in our body, a more pro-inflammatory one from omega-6 or an anti-inflammatory one from omega-3. So the big secret is that it brings what science calls specialized pro-resolving mediators, called SPMs, which generate molecules called resolvins, protectins, and myrisins. So most medicines only seek to block the inflammation process. But omega-3 goes much further because through SPMs, it provides the exact tools for our body to end, shut down, and clean up the inflammatory process that is even destroying joints. So it is an ultra-healthy fat. Adding this fat to your daily routine brings countless benefits, not just for the joints and these joint problems. So regarding the dosage, the ideal dose for those who suffer from severe morning stiffness, arthritis, and even for those who have abdominal fat, which works, as we know, as a factory of inflammatory cytokines, because the abdominal fat cell produces inflammatory factors for our body that attack the joints and articulations from a distance. So the recommended scientific dose is 1 to 3 grams of this healthy fat combined, right, of EPA and DHA per day. It's not of the total fish oil. So when you go to buy the supplement, you have to see how much EPA and DHA it has added up there because there might be other fats in there, right? Obviously. So of this good fat, 1 to 3 grams, okay? So always read the label. So if a 1,000 milligram capsule of fish oil fat has only 180 milligrams of EPA and 120 of DHA, it's not much because you'll need many capsules to get that dose. Understand? So be careful with fish oil in the sense of those that you buy very cheaply or that you leave out of the fridge. From the moment you open the bottle, if it's a liquid, you have to keep it in the fridge because it oxidizes. So when the fat, which is antioxidant and anti-inflammatory, oxidizes, you lose that benefit and it will smell bad. So either you buy the capsule version and you can leave it in the cupboard normally. If you buy the glass bottle version, which is actually what I usually buy at home, keep it in the fridge after opening to maintain its stability for longer. The fourth supplement on our list is less well known, but I wanted to bring it to you because it's very interesting. It's Boswellia serrata. It is an extract from the resin of the Boswellia tree, which is native to India and is widely used in ancient medicine, Ayurveda, and modern science has validated its benefits. The most potent active compound is called AKBA, which is boswellic acid, and it is an excellent secret revealed for those who suffer from swollen joints, mainly because while curcumin takes care of the COX pathway, which I told you about, Boswellia acts surgically on another route. It is a direct inhibitor of 5-LOX, 5-lipoxygenase, and this enzyme is largely responsible for producing leukotrienes, substances that cause an accumulation of inflammatory cells inside the joint. So what causes that swollen knee or ankle, the aching shoulder that you can't even comb your hair with, kind of full, like with fluid, swollen, hot? So many people say, I have fluid in my joint. It is this pathway that is normally activated in this case. So when it blocks 5-LOX, it reduces edema, swelling, reduces fluid accumulation, and relieves that persistent pain that is difficult for many people to diminish. So studies show that standardized Boswellia extracts bring significant improvements in pain and inflammation, usually within 7 to 14 days of use, depending on the person, which is a much faster response than other herbal medicines. So, typically, the recommended dose in studies is 100 to 200 milligrams once or twice a day. And the secret to getting more benefits is to look for extracts that guarantee at least 30 to 40% of these boswellic acids or formulations that are patented with high technology, and usually they are more expensive as well. And normally, even though it's a product that we might think, I've never heard of it, when you search online, you can find several options. Always look for a trusted supplier to ensure the good quality of your supplement. Last but not least, I brought you MSM here, methyl sulfonyl methane, which is a highly absorbable form of organic sulfur. Sulfur is the third most abundant mineral in the body and is a critical element for building the disulfide bridges that give structure and firmness to tendons, ligaments, and the joint's own collagen. So, without sulfur, the structure that holds the cartilage cells becomes loose, fragile, and more prone to breaking under any weight. Furthermore, MSM donates sulfur for the production of glutathione, our body's master antioxidant, right? I talk about it a lot here with you, glutathione peroxidase and all that. So inside an inflamed joint, there is a massive production of free radicals that accelerate the death of these cartilages, of the cartilage cells, and MSM acts by sort of cleaning up this oxidative stress and reduces the signs of chronic pain that will even travel through the nerve fibers to our brain. The dose normally indicated is 1,500 to 3,000 milligrams per day. Since it's a higher dose, right? Because actually from 1.5 to 3 grams, it's usually consumed as a powder to be diluted in water or divided into large capsules throughout the day, usually at lunch and dinner, right? In 2 doses per day. We have to pay attention because we can take the best collagen, the best MSM in the world, but if you don't drink water properly, the treatment won't be optimized. The cartilage in your joints is composed of approximately 80% water. So cartilage has a very interesting structure because it doesn't have blood vessels. It really behaves as if it were a hydraulic sponge. So when you step, the water is expelled, absorbing the impact, and when you relieve the weight, it sucks the water back in to lubricate itself. So if the body is dehydrated, the cartilage tends to shrink, losing its ability to cushion, and the friction of bone on bone can worsen, destroying the joint. So the ideal is that we normally drink about ½ ounce of water per pound of body weight every day. To make these supplements you're taking more effective, otherwise you invest a lot of money in the supplement, but you don't do something that is extremely important, which is hydration as well. To optimize your money and the result you're going to get, the ideal is that we try to learn how to combine some active ingredients. MSM works in perfect synergy with vitamin C. Because vitamin C is an obligatory cofactor that our body needs to perform hydroxylation and manufacture its own endogenous collagen, right? Which our body makes on its own. So in the morning, on an empty stomach, the ideal is that we take the 40 milligrams of type 2 collagen with a glass of water. At lunch, if you want to take all of these, you can take omega-3, turmeric, and boswellia, since they all need the fat from the food to be absorbed. And in the afternoon or at dinner, MSM with vitamin C to boost cartilage reconstruction. It is worth remembering that you do not necessarily need all of these supplements. The ideal thing is that you actually consult your doctor or nutritionist in your city to evaluate how your diet is, your health in a broader way, and check with them what is the form, the dosage, and the right time to take each one of them. Remember that this video here is merely informative. Tell me down below then if you had already heard about these supplements, if you have already used any of them. If you have used them, what was the result? I would love to see your comment. Remember to leave your like on the video. It is very important to me. And share it too with whoever you think will like it, with whoever needs it. Let's expand our chain of kindness. That's what I want here with the channel. See you next time. Bye.